You're one of the first people to start. But welcome to our Tobacco Free Tuesdays in August. We're doing it every the third Tuesday of the month. So please put it on your calendar. If you've been joining us every month, welcome back. If you have not, please start joining us and invite more people. We would love to have a full house on this. So again, we welcome. I'm going to be fairly quick with my introductions today because we do have a pretty packed agenda. You know, change your name on your screen by hitting the 3 buttons if you would like to put your organization and name up there so we know who you are. Please keep yourself on mute, but again, we would love to see your face. We will be monitoring the chat. Nicole Mann, our Eastern Regional Coordinator, who you've met on other Tobacco Free Tuesday webinars, she will be monitoring the chat. Sarah Burkhead, of course, is our Regional Coordinator from the Central Region. We have Rita Miller from the Central Office and Will Hockaday here. Our entire team, most of our team is here. We do want to welcome one new face to our group, and that's Carrie Cannon. And she has taken over, we just put her right in. She's taken over the technical aspect of the whole webinar. So thank you, Carrie. She is our Northern Regional Coordinator and just started, well, she's been here a month. We were just talking yesterday or the day before, and she's already been here a month, so time really flies, but we're so pleased to have her on board. So again, we have a pretty packed agenda. We have 3 speakers today that will be sharing their work here in Virginia, and we're excited to hear what projects they have going on. We are, of course, doing the What's the Tea with Tobacco, and that's where we want to find out a little bit more about who's on the call and what you're interested in, either from a webinar or just from your community. So we're going to start with the Tobacco Free Tuesday. We have 2 questions today, and one will be just kind of gauging where you're from. So Carrie, if you don't mind putting up that first tobacco tea question, and this is what region in Virginia you're from. So click one of those and we'll see where everybody is located. And we do have people that actually join our webinar from outside of Virginia. So we'll see how many are here today from that. And there are 2 East, I just noticed there are 2 Eastern Virginians. So we're sorry, Southwest did not get up there. 73% from Central Virginia. So we are going to really have to start. Sarah, good job doing our work from the outline areas, but welcome everyone. Now,
Hey, Gina, this is Pam Ray. If we are from Southwest Virginia, do you want us to put that in the chat so we're represented?
Yes, Pam, please do that. I noticed we didn't have the Southwest when I went. That's the first time I noticed it, and I apologize for that when I went to click Southwest. But yes, we are represented. Thank you, Pam. And our second tobacco tea question, Carrie, can you put that up, please? And that is, what would you most like to see in your local community? And as we're hearing today about different things that are going on, we really want to spur the discussion in your coalition or your group in your local area. So put what you might be interested in really working on. Okay, a couple more seconds. See what everybody chose. Okay, so cessation partnerships with local healthcare providers. Excellent, that's a great one. Rita, there you go. Rita is our cessation guru here, so she is glad to see that, I know. Okay, well, we are going to go ahead and get started. I would like to introduce our presenters today for our first program. We have Dr. Paul Harrell. He's an associate professor in the Division of Community Health and Research in the Department of Pediatrics at Eastern Virginia Medical School. He has over 10 years of experience in tobacco and drug dependence research, as well as past funding from the National Cancer Institute and the Food and Drug Administration. And joining him in the presentation is Ann Edwards, and she's a research assistant in the Division of Community Health and Research in the Department of Pediatrics at Eastern Virginia Medical School. Ann has worked on teen vaping research for the last 4 years and occupant protection research and child car seat safety for the last 10 years. Anne will be discussing the Rethink Vape project's current work with physicians, and then Paul will discuss a current related project for which he is recruiting partners. So Anne, I will turn it over to you to start the presentation.
Thank you. I'm gonna share my screen with everybody and clear the polling results off from in front of me. So as the intro said, my name's Anna Edwards. I'm part of a much bigger team who's been working on teen vaping for the last 6 years at this point. We've had 2 grants. Dr. Kelly England is our principal investigator. Amy Paulson, Paul Harrell, who you'll hear soon. Dr. Natasha Sriraman has come on the last year to help us with the MD side, and Rebecca Slimak and Emily Gordon are my fellow research assistants. We have funding from Virginia Foundation for Healthy Youth. And what I'm going to do today is give you a really quick overview of our current project, what we found out from physicians and other clinicians, and some good resources for those folks to go to. We started this project as a result of the previous grant where we just talked to teens. This time we wanted to talk to the trusted adults in their vicinity. And at this part in the grant, we're talking to physicians. We did an early teen physician survey, and we've spread out to practices asking them as well. Our goals are to increase preventative guidance given to teens about vaping, and we want it early. Training and resources specifically tailored for clinical practices, which means short and easy self-paced steps so that physicians can get up to speed on the latest information about vaping and teen vaping in particular. We had already established informational handouts for teen patients and their parents. They're available in both English and Spanish. So I'm going to run you through a few of the pertinent questions we asked on the pre-survey. The first,
you're in the presenter mode, so we can see like the next slide. Can you just switch the display?
Yeah, maybe.
Thank you so much.
If I can figure out how to get out of it. Nope, that didn't work. Sorry about that.
It's okay. I think on the top, do you see like display settings kind of on the left-hand side?
Yes.
The left corner. I think that's how you change it.
Swap presenter view and slideshow view. Is that better?
There we go. Yeah, perfect.
Okay.
Thank you.
So one of the questions we asked the physicians and nurse practitioners, anyone who would have direct contact with teen patients in their practice, is if vaping is considered a priority. And 63% said it was, but then this happens. No one felt completely confident. We had quite a few who felt maybe they could pull it off, but no one 100% felt that they could talk to teens. And that's what our program wanted them to be able to do. So we also were looking to see if they were available with knowledge with some local, really easy access. So I thought this slide would be interesting to our audience. We asked them, how familiar are you with the quit line? And 81% said not familiar at all. Now, these are pediatricians and family practice, so this might not be the target group, but we wanted to make them more aware of all of the resources that were already available in Virginia, as well as the ones we were creating. So what we learned from physicians was that the information has to be brief. They do not have time. They might want to invest time in this, but they just don't have it. So we have to give them something that they can digest really simply, really quickly. It has to be up to date because this has been a quick moving target for the last 7 years. And they want a variety of materials so they can choose how they want to use it and where it fits into their practice. So as I said at the beginning, we already had materials. We've shared these with Nicole. We've shared them with other VDHs. I know the Peninsula had our handouts. So talking to teens about vaping, this one's physician specific, but we have versions of these for everyone, parents, educators, teens. We tried to make it broken down by small bite-sized information. And this back page where you see talk with teens about vaping and it's ask, advise, assess, assist, and arrange, that comes from the APA. Now it's a longer form. If you have more time to talk to the patient in front of you, there are shorter versions of this as well, which we've shared with physicians. One thing we wanted the physician to do was to use the right wording. You can't ask a teen if they're using tobacco products because they will tell you no. They don't associate vaping with tobacco. And it's better if you don't use yes, no questions all the time so that you can get them talking. And this gave the physician a pretty quick guide to words they should use and also suggested actions. Like if you're just talking to an 11-year-old who has no exposure to vaping, you might just want to prep them for going into middle school. And this 11-year-old conversation is what a lot of doctors call sex, drugs, and rock and roll. They do it all at that 11-year-old physical right before they're going into middle school. They talk about sex and other products that besides tobacco. What our doctors came back to us and said was they wanted something even shorter. So we are in the process of developing pocket cards. So it's just something the doctor can have in his or her or their pockets that they can pull out with some quick information for the patient's parents. And then on the back, we've put QR codes that they can take a quick picture and they'll be directed to the relevant part of our website. We also have developed teen infographics that they can put up around triage stations or the back of a bathroom door. You know, your 13-year-old might not want to admit that they're vaping, but if they see it someplace and they're interested in information, they don't want to do it, they're getting a lot of pressure from their friends, we're going to add a QR code here as well so they can just take a picture and they don't have to admit to anybody that they're doing it, but it'll give them some options for help. We also included in our last talk with the physicians, we're doing this monthly, the Live Vape Free information, and also the APA has come out with new guidelines, including pharmaceutical guidelines for use with teens in cessation. So as I said, here's a parent handout, and the back is the part that most parents were interested. When we were talking to parents all over the region, they kept going, we don't even know what this looks like. We don't know what to look for. So we came up with kind of pictures of popular ones at the time. And as you know, things have changed. Juul is not king anymore. Puff bars seem to reign free. But this gives you a general idea, if you're a parent, what to look for on your kid's desk or in their backpack. And our website, rethinkvape.org, has all sorts of resources for practitioners, educators, administrations in schools, teens and parents. Most are available in English as well as Spanish, and we would be happy for you to come or contact us if you have any questions. We're more than happy to come talk to your groups as well. So that's it from me. I'm going to pass it back over to my colleague, Dr. Paul Harrell, to talk about his new grant.
Well, thank you so much. And so I'll go ahead and share my screen. So let's see, is that showing up all right? Great.
You're in presenter view, Paul.
Is it presenter view?
Yeah. Sorry, I was in the chat. Yep.
Is that better?
Yep.
Okay.
Thank you.
Yeah, so I was really thrilled to join this team back initially in 2015, and then and more with the expert panel, and then more of a role in 2018. So I'm going to talk today about a new grant that had been funded by VFHY. We're very happy about that we're getting now in 2021. And so I'm going to go briefly over some just some background materials about why this is an important issue, which I'm sure I'm kind of preaching to the choir here. So I'll go through that pretty quick, and about what we hope to do about it. So as people here, I'm sure, are aware, cigarette smoking is the leading cause of death in the U.S. and is a health equity issue with higher use rates in specific populations, particularly those with lower education or lower SES. Tobacco dependence generally begins in youth, with 9 out of 10 of those with a history of daily smoking having had their first cigarette before 18. Given that most adolescents at this time are using e-cigarettes, it's important to point out that the long-term health impact of this is unclear. We also know that youth are vulnerable. So the prefrontal cortex doesn't really become developed until later. So of course, you don't have to be an expert in neuroscience to know that teens are different than adults, right? So anyone that's spent a lot of time with teens is certainly aware of this. But we do have more evidence now about the actual neuroscience and neuroanatomy around this. And we know, though, that these are very powerful chemicals that have intense effects and are very addictive, and that teens really lack some of the skills to be able to overcome these addictions. And also, we know that adolescence is a great opportunity for intervention before teens move on into other kinds of settings where they have less supports in terms of their developmental progress. So I'm sure folks are familiar with this, that we've seen a huge rise, definitely between 2017 and 2018, in terms of e-cigarette use, greatly surpassing what we saw previously in terms of tobacco product use. This continued throughout 2019. And then in late 2019, there was the E-Valley epidemic, which led to over 2,000 hospitalizations, over 60 deaths, as well as considerable media attention, particularly before the THC diluent was identified as a primary cause. We also had changes in the federal minimum age, and FDA began some enforcement against flavors other than tobacco or menthol in e-cigarettes. So we did see some reductions from 2019 to early 2022, but still see over 1 in 5 youth still using e-cigarettes, despite the changes in the law and all the changes that were mentioned previously. And in Virginia, we've generally seen similar patterns. So this is from the Virginia Youth Survey that's done every 2 years. So we saw much higher rates in 2019 compared to 2017, with about 1 in 5 high school students reporting current vaping and over 1 in 5 reporting current tobacco product use. So that corresponds to about over 75,000 students in Virginia and over 15,000 students in the Eastern region alone. So I like to point that out just to try to, kind of bring things down more into a local level. So there are a lot of resources available for helping kids either to prevent or to cease from using e-cigarettes, but we know that there's oftentimes a gap in between research and practice. So we know this occurs in a variety of different fields. And so these are some of the statistics that are often cited regarding this gap. So it can take 17 years for research to reach practice. And only about 14% of research reaches a target recipient. So we know that there's certainly a lot of work to do to connect with these youth. So the current grant is looking to accomplish 3 specific aims, and a lot of these work in collaboration with the Adolescent Vaping Prevention and Cessation Task Force that we're currently pulling together and hoping to recruit for today. So we have 3 different aims. So the first one kind of focused on understanding adolescent risk and use. The second one, understanding available resources and gaps. And then third, trying to bridge these gaps between the adolescents and resources. So in some of the ways that we think about trying to understand this gap and what's going on with different interventions in the community is a longstanding framework, the Re-AIM framework, which recently had a 20-year anniversary. That some of you may be familiar with. So it asks us to kind of look at these different facets of an intervention. So reach in terms of how many people from the target population actually receive the intervention, the effectiveness, how many people receive the intervention are successfully treated. So typically in research, we just focus on the effectiveness. But when you look at the reach times the effectiveness, you get a sense of the impact of the intervention on a population. We also look at adoption. So is there institutional support to deliver the intervention? Implementation, is the intervention being delivered properly? And maintenance, is the intervention something that's sustainable long-term? So we also look to see, to make sure that interventions are matched appropriately. So when we think of matching different interventions, we want to be sure that that we're doing all that we can to help match specific interventions to the people that can use them the most, and that are appropriate for their specific type of risk level. So one potential way to help people do this is through some type of flow chart to help with effective matching, to help specific interventions reach the people that need it the most. So we look at doing this in terms of a type of hierarchy. So where you may have some type of initial risk assessment question that then would help determine whether someone would fall into a low risk or a high risk type of category, asking about experimentation and dependence in order to figure out whether they might need a prevention intervention or a cessation type of intervention. So in order to do this, we're looking to first develop a task force. So we're currently in the process of recruiting for that task force that then would help understand about, we really want to understand what people are seeing in the community in terms of teens and what sort of populations they're seeing, to understand really these different levels of risk that we're seeing in the community. So we'll begin this with doing data analysis from the Virginia Youth Survey, as well as getting input from the task force themselves and trying to understand these different risk levels. We'll then move into looking at available resources, policies, and procedures that people are using in terms of people at these different risk levels. So what's being done in terms of prevention, what's being done with teens that actually are currently experimenting, what are being done with teens that are having issues with dependence, and understanding how stakeholders perceive the available resources that are out there. So do people in the community think that these resources are appropriate, that they're acceptable, that they're effective? Certainly, as the next presentation will talk about, what we're concerned about, cultural sensitivity for specific resources, and how to map these resources to individuals that are appropriate for these resources. And we're also looking to train the research assistant and beginning to resolve these resource use gaps. And then in the final aim, we will be evaluating this tool and resource connection system, choosing some sites for pilot implementation and process evaluation, and then implementing the tool across these sites, as well as developing plans for continual quality improvement. So I'm certainly interested in hearing from folks and looking for people to join the task force. We're about a third of the way complete. We're looking for about 15 members, so a little bit more than a third currently. So we're looking for folks from clinical, educational, recreational, public health, or other sectors that are interested in improving how they and others address adolescent vaping and tobacco use. We're primarily focused on the Eastern region, but we potentially could expand outside of that as well. So we're currently accepting nominations for the task force. Self-nominations are currently are certainly encouraged. We're hoping to complete this initial task force assembly sometime in September. So please reach out to me if you or someone else you know might be interested. Yeah, that's all I had. Thank you very much for your time and consideration, and I'll pass it back to Gina. Thank you all very much.
Great. Thank you, Paul and Ann, for your information. That's great presentations and all of your work that you've done with the Rethink Vape. I found it really interesting during Ann's presentation that with the providers, only 81% did not know about Quit Now Virginia. So, I think there is a lot of work to be done. So that's great information, great resources. And I'm looking forward to really hearing more about the trial that you have, Paul, with what you're doing with the foundation grant. And I hope you get a lot of people recruited to your team. We will again take questions at the very end. So now I would like to introduce Avis Thomas from the Richmond Health District. Avis is a lifelong advocate of health and people being their very best. She joined the Richmond City Health District family in 2019 as the Free from Tobacco coordinator. Through community engagements, one-on-one support sessions, vendor events, virtual cessation classes, connection to free NRT, and soon to come NIC A groups, the Free from Tobacco team of 5 peer cessation coaches have made it their mission to encourage and support Richmond City residents on their journey to quit and stay quit from tobacco. And I think this was one of the first programs like this in Virginia. So Avis, I'm really excited to hear about how your program is going. Thank you for being with us today.
Good morning. Thank you. Thank you, everybody. I'm going to share my screen. Okay. Can everybody see that? Okay, good. Again, thank you, everybody. Again, my name is Avis Thomas, and I am the coordinator for the Free from Tobacco program. Our program is pretty new, but it's getting some movement out there. We started in 2019 and are just trying to grow and get our name out there. We specifically are working with Richmond City residents on their journey to become tobacco-free and to stay tobacco-free. And we have a group of wonderful, awesome coaches that are out there engaging everybody as much as possible in order to help them on that journey. So, there we go. So why free from tobacco? So basically, City Council pretty much recognized the need for the most vulnerable residents in the city to have some sort of support in order to quit and stay quit. And so they passed a 50-cent tax on cigarettes back in 2019. It became effective in 2019. So again, they wanted to make sure that the most vulnerable residents had some sort of support when this tax was created. So RCHD created a grassroots peer cessation program based on best practices in order to help connect those behavioral supports and cessation journeys with medication like the NRTs, nicotine replacement therapies, in order to help those most vulnerable in the city of Richmond. And the General Assembly pretty much created a bill that authorized any county to impose a cigarette tax up to a maximum of 40 cents per tax per pack, which became effective July 1st of this year. And basically what we know from this is that from research is that 40 cents doesn't really change behavior like $1 or more tax. However, it is a change. It is a start, and that the money that is generated from that tax can be used to create programs like the Free from Tobacco program. So Free from Tobacco, we provide one-on-one support in quitting tobacco, nicotine. This includes vaping, e-cigarettes, any form of tobacco. We connect residents with their nicotine replacement therapy, which is absolutely free. So we have, and you'll see a little bit later in the presentation, we have various partners throughout the city of Richmond where we connect residents that would like to quit in order to get their nicotine replacement therapy for free. And that's their patches, their gums, their lozenges. Absolutely free. There's no strings attached. Even if they have Medicaid or insurance, they are also eligible for this program. We are implementing cessation classes, both virtually, and hopefully we will be able to start getting back into some face-to-face ones very soon. You know, COVID has changed a lot with everybody. And so we have been able to do some virtual classes. We are looking forward to trying to get out and start some of our NIC-A groups, which will be the very first in the Richmond city area. We also assist individuals with signing up with Medicaid. We connect them with a Medicaid specialist if they need to get signed up for Medicaid. We also connect them with our Richmond City Health District communities that can help them with employment, with housing, other health needs, those different disease management, those different things that somebody may need. There may be other stressors in their life that are taking them away from their journey a little bit on focusing on becoming tobacco free. And we do this in a compassionate, non-judgmental, supportive way in order to help people quit and stay quit. So these are the areas, these are the resources in the Richmond City area where people can go and get their NRTs for absolutely free. They can just call, make a simple appointment. Unfortunately, with COVID right now, when it comes to our Richmond City Health District resource centers, right now, the only ones that are open right now are Mosby and Mosby and Hillside are the only two that are open right now. They are hoping that they will be all open in the fall, but we have to, of course, see how COVID is going with that. However, the Daily Planet, Crossover, Con, and Health Brigade are also our outside partners. People can call them, make an NRT appointment, go in, and they will walk out that day with at least 2 weeks worth of their NRTs. So that helps to cut down some of the barriers that people traditionally had when it comes to quitting, where they would have to go to the doctor, then get to the pharmacy, wait for the prescription, those different barriers. This cuts out those barriers. You make your appointment, you go in, you get your NRTs for 2 weeks. If, again, because of COVID, and if somebody is a part of the Free from Tobacco program, what we have started to do is if a resident is uncomfortable with going out into the community, they can have virtual appointments. All of these providers are still doing virtual appointments. The person will do a virtual appointment. They will have their NRT prescribed to them during that appointment. And then one of our coaches can actually go and pick up their NRT and do a no contact drop off to the client. And this is the team. So I'm in the middle, and then we have two leads and then 3 coaches that are all out in the communities, meeting one-on-one, doing group presentations, working at events in order to help Richmond City residents. So the program outline for our services, it was a lot of trial and error trying to figure out what would be best in order to help people. So what we pretty much figured out is that typically our program works where NRTs, typically someone that is really serious about wanting to quit, about 12 weeks, providing them with NRTs. So we say that between 1 to 12 weeks, somebody is going to be working with our coaches throughout the program. Throughout this time, they're doing the 5 A's, which was spelled out in another presentation. They also help the client with a referral to the Quit Now, Virginia site, where one of their tobacco specialists will help create a quit plan for that client. And then they get their connection to their NRTs and to Medicaid, through one of our partners. They're getting biweekly check-ins, at least with all the clients. And they're also completing notes in order to give feedback as to how the clients are responding to the services. When it comes to preparing for discharge, the coaches go through a little checklist with clients on how they feel they've been doing. They kind of start connecting them to other resources the client may feel they're going to need once discharge has happened, and for them to continue to be successful. They discuss various supports with them, whether it's family supports, community resources, those different supports with the client, because we want them to be successful and stay successful once they are discharged from the program. And then the coaches work with them to create maybe 2 or 3 goals that the client wants to continue to work on after discharge in order to keep them focused on their journey and making sure that they stay free from tobacco. When discharge comes around, they congratulate the client, they review all of their supports, review their goals, and if the client at any time needs our support again, everybody's always welcome back, because we do know that relapse happens and there's no shame in that. And we make sure to let the clients know that there is no shame. If you need our support, just let us know. We are here for you. And also to let everybody know that this is not a sprint. This is a marathon. This is a marathon, not a sprint. That it takes time, and that hopefully by looking at this presentation, that maybe people on the call can contact their local legislators and let them know that supporting a tax, some sort of a cigarette tax, can help create a program that is culturally competent, like the Free From Tobacco program, in order to help those local residents in your area. Thank you. I'm going to send this back to Gina. Thank you very much for your time, everyone.
Great. Thank you so much, Avis, for providing that information for us. It's a great program. Now we will take questions. So you can, I know Nicole may have a few already in the chat, and you can also take yourself off of mute and ask as well. So Nicole, I'll turn it over to you for any questions.
Thank you, Gina. Hi, everyone. Thank you to our presenters, Paul and Avis, for their great information. These programs, I think, are novel, and it's great to see that they're in our area. And I'm glad we were able to share it with other people. And this is recorded as well. So if people weren't able to attend, I'm sure they'll be thankful to hear this information as well. So I have just a few questions. The first one came earlier from Robert, and he asked, just from your experience, is there evidence to suggest that teens that use tobacco are statistically more likely to use drugs, including alcohol? Maybe Paul, if you've really been in the research realm, if you want to kind of address this quickly.
Sure. So, I mean, that's long been an issue that's been discussed in terms of ideas about gateway drugs. And so the short answer is yes, in terms of people that use one substance are often more likely to use other substances, and especially at younger ages. And again, there does seem to be some evidence that this has to do with some of the development that happens at later ages. That it takes some time for people to kind of develop the coping skills that are really important in being able to change a behavior. So I think I'm happy to talk more or point to more kinds of literature or anything if offline if people want, but in general, I guess the short answer is yes.
Thank you, Paul, for that concise answer. And next, during Avis's presentation, you were talking about the resource centers and how they can go to, I believe it was the outside partners to receive 2 weeks of NRT. And then Gina asked, after that 2 weeks, do you provide more NRT if they come back and do the program? And Avis, do you want to answer that?
Yes, so pretty much when someone attends one of the outside partners or the resource center, after they leave that appointment, they will receive a 2-week follow-up appointment in order to come back in order to discuss how that 2 weeks went. Was the gum enough for you? Typically, research shows that a combo of NRTs helps to work a little bit better. So a lot of times somebody is maybe prescribed maybe the gum and the patch, or the patch and the lozenge, some sort of combo. And so a 2-week appointment is made at that time so the person can come back and discuss how that 2 weeks went, whether or not they can continue on what they were originally prescribed, or if any changes need to be made at that time.
Great, thank you so much for that, Avis. Does anyone on the phone or on line want to take themselves off mute and ask any other questions? You can do that now. Or you can enter your questions in the chat and I can read them out loud. Okay, so we do have a question for Avis from Kizzy, I think, from CHKD. What is the youngest age for your program?
Right now, with Free From Tobacco, our program is for 18 plus. But we are working with other organizations in order to provide education to the younger generations, but the Free From Tobacco is 18 plus.
18 plus, great. We have another question. Does the individual have to be insured to receive the 2-week NRT from the partner site?
No, this program is already funded through a grant through the the cigarette tax that was created by City Council. So this program is absolutely free. So whether or not someone has insurance or not does not matter. We do try to help people that would like to get their patches or NRTs through their insurance, how to contact their insurance carrier. We have found that a lot of people have found some barriers where they have called their insurance company and it is based on medical need. And so they have to go through a prior authorization. So we still have those barriers there that people do not have by going through one of the partners or to the resource centers.
Great, thank you. And Neely asks, what is a startup cost for Free From Tobacco? I know you said it's funded through the grant. Do you have any ideas for that?
Basically, right now, I think that it all depends on what somebody wants to have out of their program. How large of an area that they're going to be working with. How many coaches do they feel that they need for that area? How many clients per coach do they feel that each coach can handle? So I mean, it all depends on those different kind of criteria. Like I said, a 40-cent increase is a start. Like I said, it doesn't really change behavior. However, it is a start where the money that is generated from that cigarette tax that can be provided in order to start up a program.
Great, thank you for all that information, Avis. Also, for the requirements for Free From Tobacco, do you have to be a resident of Richmond?
Currently, because our funding does come from City Council, our focusing is on the residents of the city of Richmond. Hopefully, we will be able to expand to some of the other localities and counties in the future. But currently, yes, our program focuses on the Richmond City residents.
Thank you, Avis. All right, this is kind of a general overview if anyone knows. Kizzy asks, currently NRT is not FDA approved for younger than 18 years old, although use is considered safe and is supported by the AAP for younger youth. Does anyone know about coverage cost for youth for NRT? Has anyone come across that? That's a good question.
We've come across it. I'm not sure if if I have a good answer for to handle it yet, but I know it is something that we've been looking into. And I can try to look into it some more, because I know specifically, with the physician that we have on the team, that we've kind of talked about costs in general for that, but I'm struggling to remember anything specific about that, but I could definitely look into that. And I know Kizzy well, or Dr. Caves, so I can definitely follow up with her.
Great, thank you, Paul. It's great to see familiar faces and local people on this webinar. Anyone else have any questions? We still have a few minutes until we go back to our what's the tea questions again. And feel free to take yourself off mute if you're comfortable with that as well.
I have a quick question. I know there was a lot of interest in the chat about using the Rethink Vape flyers. Anne, is that okay for us across the state to use those and to send them to physicians we may work with and things like that? Do you want to know if we share them? How would that work?
It would be nice to know if you share them, especially with physicians, because we're trying to see how well this works. But we would be glad for you to share them anywhere you want to share them. We've across state, other states. We tried to fill in a gap. We tried really hard not to create something that is already out there. So we think our handouts are pretty unique and offer really good information. You can either contact me directly, or you can contact rethinkvape.org. There's a resources tab, but not all of the physician ones are up yet. This is sort of our pilot group at the moment, but then we'll be sharing them widely. Nicole always knows where to get me and how to get more handouts.
They're really great. I especially really enjoyed seeing your ideas to make things faster and but with more information with the QR codes and really giving those partners what they're asking for, even though we would like for them to do more, but how to adjust to that. I'm very impressed with your different iterations.
The pocket card, as I said, doctors in our pilot asked for it, but our summer student through the Summer Scholars Program at EVMS is the one who actually designed it and came up with it. So her name's Anisha Ivanka. She's on her way. She's a William Mary student, and she did really a great job for us.
Great.
I had a quick question for Paul. What's the time, if you want to volunteer to be in your group, what's the time commitment? And you may have mentioned it in your presentation, so I apologize.
Yeah, no, that's a great question. So we will have monthly meetings, but they won't be required. Really what we're looking for is being able to get feedback on the resources. So that can be done either at the monthly meetings or through email. So it's hard to kind of give a specific number to that. But we have different rounds of feedback. So I hope hopefully that's helpful. But
is it a 2-year process or a 1-year process?
Yes. But if you're interested, I definitely would get in touch and wouldn't let that keep you away. I mean, we have every 6 months we'll review and if for some reason someone wasn't able to keep participating, that would be completely fine.
Right, thank you.
Sure. Yeah, thank you.
And Paul, for the task force, do you have any requirements for people to join? Like, do they have to have a background in tobacco or drugs is a good one, or what are you looking for? Just so people, if they're questioning or on the border of joining.
Right. We're really trying to cover a number of different areas. So I guess that's kind of what we're looking for. So we do have some representation for education, but that would be something we're looking to do more of. We're also trying to cover as much of the eastern region and maybe a little bit more. So there really isn't requirements in terms of education. We're looking to have a broad representation. to really be able to understand the gamut of what's going on out there.
And is there a deadline to join? I might have missed when these meetings start.
No, so we're still working on getting that together, but we're looking to do that sometime in September. So certainly would encourage folks that are interested to get in touch very soon.
Great, thank you. I don't see any more questions. Anyone want to take themselves off mute or send any questions the last few minutes? I'll kind of give them a minute. But I did put Anne and Paul's email in the chat. Avis, I don't have yours. If you want to put yours in the chat as well. And I did put in the links for Rethink Vape website and the Free From Tobacco as well. So again, feel free to access those websites or email them, especially for the flyers. I use them all the time. I share them all the time to people. I know I shared them with Richmond Beach Behavioral Health. They were doing a health fair with schools, and then they saw them and brought them to another health fair. So it's great, you know, network and share it and share the information for everyone. But it looks like no one else has any questions. Gina, if we want to send it back to you and we can go back to our polls, if that's okay.
Right, thank you so much. And I agree, Nicole, you know, as school is opening back up, those flyers and that information, teachers, parents, educators, health providers, it's information that is needed, that is wanted, and definitely can be used. So thank you so much for providing that. You know, we've heard a lot today about two really great programs throughout Virginia. And as part of their Tobacco Free Tuesday webinar series, we really want to do this maybe every quarter, once a quarter, share things that are going on in Virginia. So if you know of something, if you're working with a project that you feel is very successful, let us know about it. Hopefully we already know about it and we will be calling on you. But we want this to be very interactive, where this is your group again, and you know what's going on in Virginia, and you can really benefit from hearing about the Rethink Vape or from the Free From Tobacco program. And you can look at your community, because this is what we want to do. We want to look at our communities and see how we can impact tobacco control and how we can make a difference. And these are two ways that are being very impactful in Virginia. So thank you for Anne, Paul, Avis, so much for being here today to provide this. We've really enjoyed it. And as Carrie, I think, said at the beginning, this will be recorded. When you get the recording, share it. Share the recordings with your coalition members or your contacts, and invite them to our next webinar series, which I will tell you who that will be at the very end. But we really want to grow the numbers. I know August is a fairly slow month, but we're getting into September, and we really want to have a full house at each of our meetings. If you have presentation ideas that you want to learn more about, let us know. When you sign up for registration, that's one of the questions, I believe, Sarah. Yeah, I believe that's one of the questions you can put in there if you have a preference. So we are going to get back to the T question right now, the last question that we ask, and see if anything has changed from the original, your original answer. So the T question is, what would you most like to see in your local community? You know, local cigarette tax. Of course, we all want to see that, you know, because as with the Free From Tobacco, this is where, you know, that program was funded through. Culturally competent cessation programs, cessation partnerships with local healthcare providers, tobacco-free parks and recreation, tobacco-free colleges and universities, all needed in all of our communities. Cessation partnerships, I think that one led the last time. And I know I'll go back to it, but Anne, in her presentation, 81% of providers did not know about Quit Now Virginia. So, which, you know, we really need to kind of get that number up so that they know the resources out there. So click one, see if anything has changed. We're going to be working on tobacco-free colleges and universities as well. So I'm just going to throw that out. If anyone has any contacts there, please let us know. Okay, so still cessation partnerships were number one, but it is spread out. Culturally competent cessation programs came in number two. So we really need to start working on that and providing resources. You know, when you get those policies in place, we really need to make sure we have the cessation resources available for the people who want to quit. So our next Tobacco-Free Tuesday is September the 21st. Mark it on your calendar right now. Invite people. Tamana Patel, who is the director for the National Council for Mental Wellbeing, will be our presenter that day. And she will provide information on tobacco prevalence with our behavioral health population and how we can really reach that population. I believe, and Rita, correct me if I'm wrong, but about 61% of all of our calls to our quit line comes from behavioral health population. So they want to quit. Yes, so we know this population wants to quit, and we know the number is growing. We know the tobacco prevalence with this population is just so high. So please join us next month, and for that presentation, I think you will find it very helpful and beneficial. So we have 4 minutes. We thought this would be a really tight hour, and I hope we didn't rush our speakers, but we have about 4 minutes to spare, so you have 4 minutes left in your day. Tobacco-Free Tuesdays, the third Tuesday, because that's a little change, third Tuesdays. Enjoy your month, enjoy your week, and we will see you back here in September. Thank you so much to everybody.